Hi, my name is Dr. Doon Lee, board certified endocrinologist. I take care of a lot of diabetic patients, and I have written a number of prescriptions of metformin. You are aware of what metformin is. You might be taking the medication, or your spouse is taking the medication. We use metformin for various conditions, for insulin resistance, type 2 diabetes, polycystic ovarian syndrome, etc. So a lot of you probably have heard of metformin, and we are very familiar with it. Some things that you're not familiar with, I just want to share here because it is important to know while you're taking metformin. Number one is, everybody knows that metformin can give you gastrointestinal side effects from nausea, abdominal discomfort, more gaseousness, and loose bowel movements. However, patients who've been taking metformin for 10 to 30 years, they can develop it after not having issue for that long. So patients that are on metformin and suddenly they do have issues with bowel movements, they often lose their bowel. Like, for example, they do perhaps bowel incontinence, for example. And they're afraid of going to the restaurant, and they're afraid of going to social function because of this symptom. And they usually go through $1 million workup. They go through colonoscopy. They go through, abdominal CT scan to rule out this or that condition, always negative. And they come back just for a regular diabetes follow-up. And they do complain of the symptom. And first thing I do is stop metformin altogether. So if they were taking 4 tablets a day, 2,000 milligrams per day total, I would completely stop it. Usually, it's usually 99.999% of cases, they said, doctor, it completely stopped. So that's the thing you need to do first if you are having sudden bowel movement issue, like you're having bowel incontinence, socially embarrassing, and you're taking metformin. First thing you want to do is to stop metformin. And then if your blood sugar runs a little high, we can always deal with this in a different manner. So bear that in mind. Number 2, B vitamin can be reduced with metformin. So when you're taking metformin, we always check the level of B12 because B12 level can be low on metformin. And we want to keep the B12 level normal. And so if you are taking metformin and your B12 level has never been checked, ask doctor to check your B12 level to make sure we don't miss B12 deficiency. Number 3 is if you are exercising a ton, metformin may not be actually good for you. So metformin does blunt mitochondrial function enhancement that you could be getting through exercise if you didn't take metformin. So a recent study has shown that it's still a little bit debatable, but it seems to be the case according to the most recent clinical trial, although the sample size was small. So if you're exercising 1 hour a day, significantly vigorous intensity of exercise, possibly you don't need metformin. You may need some other agents. And so think about that as a possibility. So those were the 3 things that I wanted to discuss about metformin so that you know what you deal with when you have those issues. So hope this video was helpful, and thanks for watching.